nerve passes down to the hand, and it provides innervation to the last 1.5. And we'll talk about that.
So when you break your arms, can they damage these nerves?
You can. You can. So these 5 nerves are very, very important. Okay. Now, the other 2 plexuses are the lumbar and the sacral. Some people like to combine them and call them the lumbosacral plexus, but not us. No, we don't roll that way. We're going to separate them into the lumbar and the sacral. And the lumbar is easy. L1 through L4. Okay? The most important nerve of which is the femoral nerve. The femoral nerve runs deep to the inguinal ligament, and it supplies the anterior thigh muscles, the most important of which is the quadriceps muscle. Okay. Now, I'm going to teach you about navel. Have we talked about navel?
No.
Okay. This is something that's very, very important.
You gonna tell them the story too?
Yeah, I'm going to tell you the story.
Thanks, Hunter. Keep them in check.
Now, we ever talked about the fact that if you look at yourself naked, you see a crease? Okay, but some of you didn't want to do that.
Yeah, we don't have that space.
Was there anybody here that's never looked at themselves naked?
That has never?
Yeah, because I remember, or maybe it was the other class. I think it was the other class. We asked, has everyone looked at themselves naked? And there were several people who had not.
It's not pleasing.
They're all right.
So you've all seen each other naked, okay?
Each other? Yeah, definitely. All the time. That's why Colin thinks he has syphilis.
Let's go. Keep trying it. Like, this is
All right. Now, deep to that crease, that inguinal crease, there's going to be an inguinal ligament. You're familiar with the inguinal ligament.
Yeah.
It extends from as is down to the pubic tubercle. Any important structure that provides innervation or blood flow to the lower extremity has to pass deep to that inguinal ligament. Okay? So let's go through our naval mnemonic. So we're going to call this our naval mnemonic. This is from lateral to medial. Here's the femoral nerve. Okay. Now, I'm going to draw the femoral artery in pink because arteries are kind of pink or red. So this is going to be the femoral artery. And then for the femoral vein, I'll use blue. Okay. Then medial to the femoral vein, there's a little empty space. And then medial to that is femoral lymphatics, which I'll draw in green. So from lateral to medial, we have nerve, artery, vein, a little empty space, and then lymphatics. So it spells out the mnemonic naval. Now, of course, remember that this goes lateral to medial. So on this side, it would be like this.
Levan.
Okay.
Levan.
Levan, right?
That's what I'm naming my child.
All right. So
That I'm never
I think I was pointing out to the other class that this mnemonic is very important. And I'm going to give you an example of its importance. One time we had a gentleman at Turo on the 7th floor med-surg unit who received a new medication to which he had a reaction. And he became hypotensive. So much so that he wasn't getting good blood flow upstairs and he lost consciousness. And a code was called because the nurse went into the room and the guy was unconscious. So we call the code, and when the blood pressure falls too low, the peripheral veins from which you typically draw blood collapse. And so while we're coding the patient, we ask the nurse to do a deep femoral puncture. In other words, to stick the femoral vein so that we could submit blood to the lab for studies. And the way you typically do a femoral puncture is you palpate the pulse provided by the femoral artery, and you go about a finger breadth medial to it. And then if you stick about a finger breadth medial to the femoral artery, you're going to hit the femoral vein. Now,
How do they go about taking blood from there? Like,
well,
I mean,
you
I
take
know
a-
what you just said, but I
you
mean,
take
like,
an open core needle and you simply advance it deep to the skin in that area. And you typically
Do they
hit
do
the
this
vein.
when people are alive or only when?
No, you do it sometimes. You can do it when someone's alive.
Okay.
Okay. In fact, when you do cardiac catheterizations, you'll pass catheters through a femoral vein sometimes. Now, what this nurse did though, is that she wasn't as familiar with her anatomy, and she palpated the femoral artery pulse, but instead of going medial, she went lateral, and she transected the femoral nerve. So, it turns out then, with the code, and we gave the patient plenty of fluids, we gave fluid resuscitation, his blood pressure came up, he woke up, and from a cognitive standpoint, he did well. The effects of the medication wore off, but then when he went to get out of bed, what do you think happened? He couldn't walk. He
Lawsuit.
couldn't walk. And so, the long and the short of it is he was in rehab for about 6 to 12 months, learning how to walk again. And everybody was very, very nice to this gentleman because we knew it was a potential lawsuit. He eventually got discharged from the hospital. And then what do you think came next?
Lawsuit.
A lawsuit.
So did he, like, did y'all tell him, or were you just like, you don't
No,
know,
we were
really?
honest. Yeah, I
Yeah,
mean,
you are.
there's no escaping certain things. So in this particular lawsuit, what happens typically is when they file a lawsuit, the plaintiff attorney obtains medical records, and initially he names everybody whose name is in the record. But sooner or later, everyone except the key players are extricated. You know? And so it came down to really the nurse being sued. And I was in on it simply as a fact witness. In other words, a code was called, I was on the 6th floor, I came up in the middle of the code, and I could kind of see what was happening. Okay? So what the plaintiff attorney did then is as the case was proceeding, he got one of these tripods where you could put a chart. And so he had a big old chart that showed an image something like this. Okay? Except a lot nicer. And then he called in an LSU, not a nursing student, a pre-nursing student. And so he had the pre-nursing student take the stand, and he asked her, okay, what courses have you taken? And she said, I've taken A&P 1 and 2. And so he said, oh, those are prerequisites for nursing school. And she says, yes. You have to have A&P before you can apply for nursing school. He says, great. He said, do you recognize the femoral nerve and the artery and the vein up here on this chart? And she said, of course. And he said, of course. What do you mean by that? She says, all pre-nursing students have to learn this little mnemonic. And she went on to explain that the femoral vein is always medial to the femoral artery. Okay? And he says, well, then if somebody were to try to obtain blood from the nerve, if they went lateral to the artery, that would be a big mistake. And she said, oh yeah. He says, you would know that that was a mistake. And she said, oh yeah, because the vein is always medial to the artery. So she was going into teacher mode. And so he was establishing in the eyes of the jury right away that even a pre-nursing student who doesn't even have an RN knows that that would be a huge mistake.
That's so wrong.
And so he was, but this is what plaintiff attorneys do.
Right.
So he was establishing in the minds of the jury that this nurse was an idiot. Okay, that's what he was pretty much saying
Great.
as he went. And so the malpractice attorney for the hospital, you know, what happened is that after the plaintiff attorney finished interviewing the nursing student, the pre-nursing student, it was kind of the malpractice attorney, the defense attorney for the hospital's turn. And instead of going up to the pre-nursing student, which I thought he was going to do, he went right up to the judge's desk. And he said, can we meet in chambers? So they were going for about 45 minutes.
Doesn't that mean you
Everyone
settle?
else was waiting.
Settled.
They settled
Yeah.
for $500,000. Okay? Do you think we ever saw that nurse again?
No.
No. Once something like that happens, you're blackballed. Does that mean you can't practice again? If you do practice, it's going to be in an area where you can't hurt people. Okay? You're going to be working in a hospice or maybe a nursing home where you're not providing acute care. But you certainly can't work in a hospital again. Okay? So anatomy is important. Anatomy is very important. So the femoral nerve, by the way, provides innervation to those muscles along the anterior portion of the thigh, the major one of which is the quadriceps. The quadriceps is actually made up of 4 individual muscles that are bundled together. Okay? They're connected to the patella via the quadriceps tendon. So when you do the knee jerk reflex, okay, that extension of the knee is due to contraction of the quadriceps. Contraction of the quadriceps brings about extension of the leg at the knee. Now, the other nerve that you need to know that comes from the lumbar plexus is the obturator nerve. The obturator is located more medially. Okay? And it's going to come and it's going to provide innervation to muscles along the medial aspect of the thigh. These are called adductors. These are the muscles that when you do the jumping jack and do this, they bring the legs back in. They adduct. Remember, the obturator nerve passes through the obturator foramen. Again, it's located more medially in relation to the femoral nerve. Okay? The lumbar plexus, by the way, is anterior to the sacral plexus. The axons that give rise to the sacral plexus join along the posterior aspect of the sacrum. Okay? And the major, and by the way, it includes axons from L4 to S4. So lumbar plexus L1 through L4, sacral plexus L4 to S4. The major nerve that comes off the sacral plexus is the sciatic nerve. Okay? And it's going to give off numerous branches as it travels along the posterior aspect of the entire lower extremity. So if we look at this lower extremity here, nerve, artery, vein, that's the femoral nerve. Posteriorly, sciatic. Extends all the way down the lower extremity. Now, the other nerves you need to know that come off the sacral plexus are the superior and inferior gluteal nerves that supply the muscles of the buttocks. Can I say that? Buttocks?
That's it.
And then finally, the pudendal nerve. We talked about the pudendal. We said that someone who's about to give birth, you can do a pudendal block. We said the pudendal nerve passes right next to the ischial spine. So you can locate that landmark and you can infiltrate that area with an anesthetic so that you can numb up the pudendum. Okay? It also mediates the act of an erection. And it's involved in voluntary control of urination. So let's look at the lumbar and sacral plexus. Here's the lumbar plexus, L1 through L4. Again, lots of nerves emerge from it. The ones you have to know, femoral nerve, and medial to it, you're going to find the obturator nerve. Notice that these are anterior in terms of relationship to the thigh. If we're demonstrating the sacral plexus, we have to go posterior. Superior, inferior gluteal. Sciatic nerve is easy to recognize. And the pudendal is going to supply the perineum or pudendum. Okay. The last thing we're going to say, and then we'll take a break. Dermatomes. These are areas or patches of skin that sensory nerve fibers of a particular spinal nerve innervate. Okay. So a map of the dermatomes is often useful in localizing the sites of injuries to dorsal roots that carry sensory axons or to the spinal cord. Give you an example. This is a dermatomal map. Okay? Let's say someone has a herniated disc and they're compressing the L4 spinal nerve or its dorsal root. The person is then going to have numbness and tingling, or perhaps a loss of sensation in this region of the lower extremity, in the L4 dermatome.
That's a great thing.
Okay? So we can use the dermatomal distribution of a sensory deficit or of paresthesias to help isolate the location of a lesion. This patch of skin that corresponds to a particular dermatome is going to be related to a particular spinal nerve. Okay. This last slide just reminds you of your somatic motor pathway and sensory pathways. Here's your somatic motor pathway up here. Remember that upper motor neurons begin in the primary motor cortex. Their axons pass through the internal capsule, down the brainstem. Most of the axons, 80%, cross at the decussation, travel down the lateral white columns, and synapse at the appropriate level of the spinal cord within the anterior gray horn, okay, with the lower motor neuron. That lower motor neuron is then going to, its axons are going to leave the spinal cord and provide innervation to a particular muscle. So, somatic motor pathways involve two neurons, upper and lower. Sensory pathways, 3 neurons. You have a primary neuron coming in from the periphery. It's going to synapse with a secondary neuron that may either cross immediately or cross a few segments up. That secondary neuron is going to synapse with the thalamus. And then a tertiary neuron, a thalamic neuron, is going to pass to the primary somatosensory cortex. All right, that was a lot of stuff.
Was